What's the value proposition here? HealthiNation, when investors look at this, they look at your current offerings and they look at what HealthiNation brings to the table. What's the value proposition?
GoodRx has long been, an important point when a patient is actually purchasing a prescription and making that decision. But HealthiNation helps us to expand our touch across multiple parts of the patient journey with incredible videos, literally thousands of videos about all sorts of topics and really, really important information so that we can also educate consumers and not just talk to them about price, but talk to them about the condition that they're living with and how to get better. And so it's really, really incredible content, especially for disadvantaged communities. They've got an incredible program with all sorts of different folks out there to really make sure we're speaking to people at all levels and make sure that we just deliver the best possible content.
But it's not just consumers, right, Doug? It's manufacturers that are going to learn a lot through this as well. How is that going to benefit that relationship?
Yeah, it's really a great program because it helps us to connect pharmaceutical manufacturers with consumers. Consumers are thirsty for information especially about, brand name drugs or drugs they're not familiar with or the doctors prescribed. And HealthiNation makes it all easy. They work with healthcare professionals, they work with doctors, they create really simple, easy to understand videos, thousands of videos around, hundreds of different conditions that literally a patient can just watch, can understand better. Their doctor can direct that. Oftentimes they even have videos in doctors' offices, all just trying to make it easy and educate consumers so they understand, what they're living with.
The business model, explain it to me about the monetization value of this. We see targeted audiences, right? Targeted advertising. Some people flare up in terms of how their data is being used. How do you monetize this?
Sure. I mean, HealthiNation today has, ads that run often a pre-roll ad prior to someone watching a video, where pharma wants to introduce themselves to a consumer who's living with a condition. And, that's a great revenue model. It's worked for them. And for us, we just want to connect manufacturers to consumers. We do it in the right way, which is, when a consumer is choosing to read or consume content, they can obviously learn information about drugs that might help them or other advertisers who want to get in front of that consumer who's living with that condition. But it's pretty straightforward. It's kind of like what you would see on other places where consumers can watch videos or read content.
Doug, let's talk about just the longer-term strategy for the business here. You had a pretty successful IPO last fall here. The shares have been under pressure, and a lot of that seems to be tied to concerns about competition and how GoodRx stands up in the face of more players and bigger players, for that matter, coming onto your turf here. How do you respond to some of those concerns here? And is there sort of some strategy to sort of build a moat that maybe makes GoodRx a little bit more immune, if you will, to some of those challenges?
I've actually never felt better about our business. I think there's a lot of confusion in terms of how both the pharmaceutical industry works as well as healthcare in general. The reality is Americans are suffering, and as the coronavirus pandemic starts to recede, Americans will, be left with the other healthcare crisis we have, which is that it just simply costs too much and the existing solutions aren't working. And we feel like people have never been more engaged to try to come up with a new way or, to try and figure out just a reasonable way for them to find the care they need. And we feel like we're perfectly positioned. We are the patient's advocate. We work with patients, millions of patients. We find them savings. We find them great information. HealthiNation is a great complement for us to just be able to talk to consumers honestly and openly, which, to be honest, has been lacking in the system for so long.
Honestly, openly. Let's talk about, you're trying to bring more transparency in the way that you've got appointment trackers for COVID-19 vaccines and the like. But what about what we're seeing in terms of, the reopening being questioned when we see numbers of COVID tick back up higher? Are you worried about how your consumer base is placed at the moment? You're most optimistic about your business, but what about the consumers out there?
I mean, honestly, everything I'm seeing is consumers are re-engaging. We're seeing it across the economy where people are coming out of their homes. They're finding it. I think there was almost 1 billion health conditions that were undiagnosed and untreated over the course of the last year, and people are coming back out. We are here to provide consumers with information about coronavirus, how to get vaccines, and then once they're vaccinated, we want to get them on the right track to take care of all those other conditions that people have left untreated for so long. And we're seeing it. I mean, we're really, really confident in our business. We're rolling out incredible new products. And we're looking to talk to people across the healthcare journey, not just at the pharmacy counter, not just when they're trying to figure out how to solve their prescription issues, which is, 10% of the $4 trillion that Americans spend. But that other 90%, we feel like we've got that relationship, and we're excited to extend our reach and to talk to those consumers across the entire healthcare journey.
Is demand holding up the way you thought it would in 2021, given the pace of the reopening? Is it on track?
We are feeling really confident in our business. Things are generally going really great, and we are very, very confident that again, we've never had a better relationship with consumers. We have the best products out there. We're just really, really excited about 2021, and we think that we have this incredible opportunity to teach consumers a better way to both get their prescriptions and to get their care, and to really touch them across this healthcare journey. It's going to be an amazing 2021. We're really confident.